For the best in eyewear, call Dr. Leek's Optometry.
We are not socially distancing as much as we were before. We don't wear our masks as often as we do, and we are meeting people more. We're in crowded spaces.
Dr. Vyas, like other physicians across the country, says she's noticed a recent rise in respiratory viruses, especially in young children. She says we typically see viruses like the common cold and RSV in the fall and winter, but they're popping up off-season. In fact, the CDC recently issued an advisory in the South due to an increase in RSV, which can be severe for babies and the elderly. So how do we prevent an annoying summer cold, or worse? Dr. Vyas says it's always important to practice good hand washing and sanitizing, whether we're in the midst of a pandemic or not.
We should be more vigilant about when we touch high-touch surfaces and making sure that we do wash our hands before we touch our faces, or certainly before we eat.
Dr. Vyas says COVID-19 symptoms are often similar to those of a cold, and she says the best way to rule out COVID-19 infection and protect yourself from the virus is to get vaccinated.